Hematuria Diagnosis. What tests should you expect? If you notice blood in your urine, it can be worrying, but understanding the diagnostic process can help ease your concerns. When hematuria is detected, doctors follow a series of tests to find out what's causing it. The first step is usually a urinalysis, which involves examining a urine sample under a microscope. This test looks for red blood cells, and if there are 3 or more in a high-power field, it confirms microscopic hematuria. Often, a single properly collected urine sample is enough to detect hematuria because about 95% of cases are identified with one test. Sometimes, a dipstick test is used initially, but positive results should always be confirmed with microscopy, since false positives can happen due to substances like bleach or certain medications. Next, doctors want to figure out where the bleeding is coming from. They may order additional urine tests to check for signs of kidney problems, such as protein in the urine or red blood cell casts, which suggest issues within the kidney filtering units. If these signs are present, the cause might be related to glomerular disease, and a specialist called a nephrologist might be involved. If these signs are absent, the bleeding is more likely from the urinary tract outside the kidneys, like the bladder or ureters, and urological evaluation is needed. Imaging studies are then used to look inside the urinary system. The most common and detailed test is a computed tomography scan of the abdomen and pelvis, often called a quart urography. This scan uses contrast dye to produce detailed images of the kidneys, ureters, and bladder, helping to identify tumors, stones, or structural abnormalities. If a person has allergies to contrast dye or kidney issues, alternative imaging options like magnetic resonance urography or retrograde pyelography may be used instead. A key part of the evaluation, especially if there is concern about bladder cancer, is cystoscopy. This procedure involves inserting a thin tube with a camera through the urethra to directly look inside the bladder and urethra. Cystoscopy is highly sensitive for detecting bladder tumors and is recommended for patients over 35 or those with risk factors such as smoking or a history of gross hematuria. It allows doctors to see any suspicious growths or lesions that might need biopsy or removal. Urine cytology is another test that examines urine cells for cancerous changes, but it is not usually part of the initial workup because it has limited sensitivity. It can be useful in high-risk patients or when bladder carcinoma in situ, a flat form of early bladder cancer, is suspected. Sometimes, more advanced tests like fluorescence in situ hybridization are used in difficult cases, but these are not routine due to higher costs and complexity. It's important to remember that the evaluation begins after ruling out benign causes of hematuria, such as menstruation, vigorous exercise, or urinary infections. The decision to investigate microscopic hematuria in people without symptoms depends on age, risk factors, and overall health. Generally, guidelines recommend starting evaluation at age 35 or older. The goal is to balance thoroughness with minimizing unnecessary invasive procedures or radiation exposure. In summary, if hematuria is detected, your healthcare provider will likely start with a urinalysis, followed by imaging studies like a quart urography to check the upper urinary tract. They will also perform a cystoscopy to directly examine the bladder. Additional tests like urine cytology may be used in high-risk cases. This comprehensive approach helps identify causes ranging from benign conditions to more serious issues like bladder cancer, ensuring you receive appropriate care. Always consult a healthcare professional for personalized advice and diagnosis, as each case is unique.